Thank you for this opportunity to talk to you about how proud we are of the work of the Lancashire Care Capacity Tracker. On behalf of the Lancashire Resilience Forum, the County Council and partner councils, 8 CCGs, the Lancashire and South Cumbria iESE, and most of all our providers, residents and service users, I'd like to tell you about our work in relation to the award for transformation in health and social care. So an overview of the Lancashire Care Capacity Tracker. Its primary purpose is to keep our service users, residents and the staff who support them safe and able to carry on with their everyday responsibilities by identifying and then promptly addressing service delivery issues in the middle of a pandemic that has disproportionately affected our county and the sector as a whole. In terms of a start date, as we will hear from shortly, the final push came from Lancashire Constabulary and military planners in mid-April 2020 as the preferred signal system. But as a county council, our planning had started weeks earlier, and we had hatched the idea of a tracker in March 2020 and begun to work on the calls and the different pathways that would be needed to support our significant number of providers and keep residents safe in the light of the advancing pandemic. We needed to be ready and mobilised at lightning pace, and a redeployed workforce was needed to be established to make person-centred calls, which has ultimately strengthened our two-way communication and quality relationship with our providers at a time of great stress and pressure. The current status and spread of the tracker cannot be overestimated. You will see the number of agencies across the LRF and the iESE that have access to the tracker and access it daily and understand how they need to respond. The data we can upload into the national trackers and databases from our Lancashire tracker is outstanding in its depth and spread, and is drawn down by partners and is looked at both at a regional and national level. A critical point around the status of the Lancashire tracker, however, is how much more expansive it is than other systems, as it has always incorporated community providers such as home care and supported living, and more recently day services and not only residential care. To set the context around the Lancashire Care Capacity Tracker, I would like to introduce Chief Inspector Gary Crowe, who alongside the members of the LRF sanctioned its rollout as the primary source of data and response to Lancashire's care sector.
Often the data requests were very onerous, duplicated each other across a number of different trackers, and we found that particularly from the frontline carers, they were finding that the appetite for data was actually proving to be the greatest blocker to the delivery of care. So between the Resilience Forum and the adult social care sector, we decided to set the priority of minimising that demand by aggregating the data return into one single unified tracker.
Geographically, Lancashire is twice the size of the Greater London area with a large and diverse population equal to Estonia. It has a significant number of care homes and we have experienced the highest alert levels since March 2020. Prior to the start of the pandemic, real-time information on the status of Lancashire's care market was limited. Providers sent similar data to several different sources. This was a burden and diverted them away from caring for their residents. We developed the Lancashire Care Capacity Tracker as the solution to this problem. The reason we chose this solution was that we needed a single data collection, recording and enabling system to establish speedy and relevant support pathways. This project is and continues to be delivered in extremely challenging times and is a real Lancashire team effort. The tracker has and is still evolving and reacting to ongoing situation, expanding its data collection, reviewing and improving its efficiency and effectiveness, as well as looking to the future beyond the pandemic. At pace, this project mobilised a small army of 200 plus volunteers, redeployed staff from LCC whose services were on hold, trained them and continued to support them to make daily calls to our providers. These daily calls not only collected the information we needed to respond in the right way, but also reassured providers that they were not alone. Simply asking the provider, "How are you today?" was of value. The project set up unique pathways to ensure the right support was directed to a provider in a timely manner. 99% of the time, that support was delivered the same day. The data solution gives live information on an interactive platform for everyone who needs it. Data is extracted to be used externally or uploaded into other data systems, including the national data set, ensuring high response rates. Lancashire's corporate leadership team recognises the key role the tracker has played and have committed their support until March 2022. To ensure sustainability, the daily calls have now been transferred to our customer access service, allowing the redeployed staff from across the authority's services to return to their substantive posts. The learning from this project will feed into how we collect and analyse data going forward, allowing Lancashire to have a greater understanding of its care market.
The focus of our process has been on ensuring the well-being of residents and staff who work in our care sector. The daily calls have reinforced to our providers that we are indeed in this together. This is highlighted by our response to their queries and concern, enabling us to provide same-day action in relation to reported low business confidence ratings and staffing pressures. Our contracts teams discuss concerns and agree actions to support, such as deployment of staff from our temporary staffing agency. Our daily calls also enable us to provide timely advice and guidance when providers report COVID cases. It is also worth noting that in the midst of all the pressures, providers lose sight of business as usual processes such as reporting outbreaks to Public Health England. Our daily calls then are a reminder of these processes, but at the same time gives us an opportunity to start acting on the information before it reaches us from the official route. The tracker is a product of our engagement with providers and their ask of us to have one data collection point, allowing them to focus on caring. This single data capture also supports professionals in coordinating our response, as we are then all looking at the same information, and thus there are improved efficiencies in not having to regather the information. The most significant benefit for the County Council and our stakeholders has been our ability to adapt and be flexible with the information we are collecting. We have responded to emerging challenges and added a layer of data collection in addition to national asks to allow a more effective response. A key area where this can be evidenced is around the testing process. We developed specific testing questions to support us in working with our providers to ensure national guidance was being adhered to, thus protecting staff, residents and the wider population. We've recently further built this section to incorporate data collection on lateral flow testing, which will help us to monitor adherence to the lateral flow testing fund grant conditions. Critically, thus far, we have not seen any provider failures as a result of the pandemic.
The success of this project is principally down to the people involved, from the redeployed staff from across the authority, majority of which have no adult social care background, to the teams ensuring the providers had what they needed. Although this project has been developed and delivered during challenging times, the teams have learnt to remotely manage 200 plus volunteers and the relevant support teams, most of which coming together for the very first time, provide timely updates and guidance to the 700 plus providers through webinars, weekly bulletins, emails and the provider portal, logistics, distribution and delivery of PPE. To date, over 8 million items have been provided, majority of which on the same day. IT, utilising an existing IT system to record the ever-changing data requirements to reflect the current situation, and data analysis using a new interactive platform to view and analyse data. My background is not adult social care. I am from environmental services, waste management and more recently highways and transport. I had not managed a team of people, let alone remotely. I had not mobilised and supported 200 plus volunteers or had any knowledge of the IT or data analysis systems I now use daily. This project has given me the opportunity to enhance and develop my skills. This project has forged a "we are all in it together" approach that has developed and strengthened the skills and capabilities of the individuals and organisations involved.
I would like to leave the final word to one of our valued providers.
What has been reassuring to us has been the response from the contracts team within Lancashire County Council when any positive cases have been recorded. We have always received welfare calls when logging positive cases, and this has always offered us one point of contact for help and support, to check if we need anything and also to reassure us that we're doing an amazing job. It was also reassuring to know that the information that was inputted daily when time was so precious was actually being looked at and acted upon, which enabled LCC to respond to our needs so quickly.